When it comes to understanding your body, one of the simplest and most revealing tools we have is something you see every day, your urine. It's easy to overlook, but the color of your urine can tell you a lot more than you might think about what's going on inside your body. Now, I know what you're probably thinking: how could something as basic as urine possibly give me insight into my health? But trust me, your urine is a powerful indicator of how well your body is functioning. It's actually a reflection of what's happening at a deeper level, from your hydration to your nutrition, even your kidney health. Urine color is primarily influenced by how much water you're drinking. Think about it like this: when you're dehydrated, your body holds on to the little water it has, making your urine darker in color, almost like it's trying to conserve as much fluid as possible. On the flip side, when you're well hydrated, your body excretes excess water, leading to a lighter, paler urine color. So hydration, or the lack thereof, becomes the main story your urine is telling you. But it's not just about how much water you drink. What you eat, how active you are, and even the medications you take all play a role in your urine's appearance. For example, if you've recently had beets or blackberries, you might notice a reddish tint to your urine. Certain vitamins, like those in the B complex group, can turn it a bright, almost neon yellow. That's all part of the picture. And then there are other things, like certain health conditions, that can change the way your urine looks. For instance, if your kidneys are struggling to filter properly, it could lead to darker urine or even cloudy urine, which might be a sign of an infection. But here's where it gets really interesting. Your urine is talking to you all the time. If you pay attention to the color, you can tell whether you're in the green zone, meaning you're properly hydrated and your body is functioning well, or if you're sliding into the yellow zone, where dehydration may be creeping in. It's like your own personal early warning system. The best part, it's completely in your control to make changes and see improvements almost immediately. So what does this mean for you? For the next 7 days, I want you to look at your urine every time you use the bathroom. Yes, I'm asking you to pay attention to what you've probably never even thought about before, but I promise you it's going to be eye-opening. Think of it like a challenge to get more in tune with your body and the simple things you can do to feel better. If you notice that your urine is on the darker side, it's a great sign that you need to drink more water. Start making those adjustments, and you may find yourself feeling more energized and more clear-headed by the end of the week. At the end of the day, urine color is one of the simplest yet most effective ways to keep tabs on your health. It's a reminder that even the smallest changes, like staying better hydrated, can make a huge difference in how you feel and how your body functions. You don't need to wait for symptoms or big health concerns to get your attention. Urine's little messages are here to help you catch things early and keep things in check. The key is to listen, to be mindful, and to make simple, consistent choices to take better care of your body. So pay attention, and let's get started on this 7-day challenge. Let's talk about the good stuff, the ideal urine color that we're all aiming for. You've probably heard the phrase "drink more water" a million times, but there's a reason why it's constantly being repeated. It's one of the most important things you can do for your body. When you're properly hydrated, the color of your urine should be pale yellow, almost clear. In fact, that's the sweet spot. It's the perfect sign that your body is getting the fluids it needs and that your kidneys are working efficiently, filtering out waste without being overloaded. Think of your kidneys as the body's personal filtration system. Their job is to take the waste products from your blood and remove them through your urine. When you're hydrated, the kidneys don't have to work as hard because there's enough water to flush out the toxins and excess waste. That pale yellow hue you're seeing, it's a result of the pigment in your urine being diluted with water, which is exactly how things should be. This is your body telling you that things are running smoothly. One of the best ways to think about this is to imagine your body like a car. You know how a car needs the right kind of oil to keep the engine running smoothly? Well, your kidneys need water to keep functioning at their best. When your body gets enough water, it's like giving your engine the right kind of lubrication. It just runs better. And not only does your body feel better, but your urine color is the visible sign that you're doing something right. The clearer, the better. It's really that simple. You want to keep that beautiful light yellow as a goal. It tells you your body is hydrated and your kidneys are happy. This is where the challenge comes in. Over the next week, I want you to make a point of checking your urine color every day. If it's pale yellow, celebrate, you're doing great. Keep it up. But if it starts to get darker or you notice it shifting toward amber, that's your body sending a message that it's time to drink more water. The beauty of this is that it's not a hard-to-follow process. It's just about consistency. You don't have to be perfect, but the more aware you are of your hydration levels, the more empowered you'll feel in taking control of your health. Now, this pale yellow isn't just about hydration, it's also a reflection of your kidneys doing their job well. Your kidneys act like filters, processing around 50 gallons of blood every day. They pull out waste products, excess water, and other materials that the body doesn't need. When you drink enough water, you're essentially giving those kidneys what they need to perform this task without straining. The clearer your urine, the more efficient your kidneys are at processing and flushing out waste. That's the magic of hydration. It's not just about feeling thirsty or dry, it's about supporting a vital system in your body that is working tirelessly behind the scenes. So why is this important? Because dehydration doesn't just cause thirst, it can lead to all sorts of issues. It can put stress on your kidneys, increase your risk of kidney stones, or even affect your ability to concentrate and think clearly. When you see that pale yellow urine color, it's a cue to keep doing what you're doing. It means your body is running optimally, your kidneys are happy, and you're on the right track. This is a good time to note that, while pale yellow is the ideal, you don't have to be obsessed with making sure your urine is completely clear all the time. The point is consistency. A little variation is okay, but if you're seeing darker yellow consistently, it's your body's way of saying, I need more water. So with this 7-day challenge, focus on making small adjustments to your water intake. Set a reminder to drink water regularly and see if you can keep that pale yellow as your target color. Remember, this is all about creating a healthier, more balanced lifestyle. When you feel better, you're more likely to make healthier choices overall. Hydration isn't just a simple task, it's one of the easiest and most effective things you can do for your body. So let's keep that pale yellow as our benchmark and start paying attention to the messages our bodies are sending us. Now let's get back to that challenge and see how your urine color changes over the next 7 days. Now let's talk about what happens when your urine starts to turn a darker yellow or even amber. If you're seeing these shades, it's your body's way of telling you that it's not getting enough water. Dehydration is a lot more common than we think, and the signs can be sneaky. You might not feel thirsty, or you may chalk it up to just being busy, but your urine doesn't lie. When you're dehydrated, your body tries to conserve water, and as a result, your urine becomes more concentrated, taking on a darker yellow or amber color. This is actually a sign that your kidneys are working harder to filter out waste with less water available. Dehydration can happen more easily than you think. A busy day, not drinking enough water during your workouts, or even a warm climate can cause your body to lose fluids faster than it can replace them. When that happens, your kidneys will hold on to the fluids they have, which leads to that darker urine. It's like your body is telling you, I need more water to keep running smoothly. But here's the thing, dehydration isn't just about feeling thirsty. In fact, by the time you actually feel thirsty, you may already be in a mild state of dehydration. That's why paying attention to your urine color is so important. It's an early warning system that can give you the heads up before things get too out of balance. If you're seeing dark yellow or amber urine consistently, it's time to take action. The good news is that hydration is one of the easiest things you can fix. All you have to do is drink more water, and you'll start to see your urine lighten up in just a few hours. Now I know you might be thinking, how much water is enough? The standard recommendation is around 8-ounce glasses a day, but that's just a guideline. Everyone is different, and your hydration needs depend on things like your activity level, the climate you live in, and even your diet. For example, if you're eating a lot of salty or spicy foods, your body may need more water to help process that extra sodium. Similarly, if you're exercising more or spending time in hot weather, you're losing more fluids through sweat, and you'll need to drink more to make up for that loss. The key is to listen to your body, and that's where your urine can be your best friend. The darker your urine is, the more it's telling you to take in fluids. Don't wait until you're thirsty. By then, it could be too late. Start incorporating water throughout the day. Keep a bottle with you at all times, and try to sip consistently rather than gulping down large amounts all at once. You'll be amazed at how much better you feel when you start staying on top of your hydration. If your urine is consistently dark, that could also be a sign that your body is holding on to toxins longer than it should, which can lead to other issues over time, such as kidney stones or urinary tract infections, UTIs. It's a lot easier to avoid these problems by staying ahead of dehydration before it becomes a bigger issue. Keeping your urine at that light yellow shade is more than just a visual cue. It's a simple way to prevent more serious health concerns down the road. One thing to keep in mind is that dehydration can affect more than just your kidneys. When you're dehydrated, your body can't perform at its best. You might start feeling sluggish, tired, or even dizzy. Your skin may lose its elasticity, and you might notice headaches creeping in. This is because water is involved in nearly every function in your body, from regulating body temperature to supporting digestion. So when you see that darker urine, think of it as your body waving a little red flag, an easy way to remind yourself to drink more. As we move through this 7-day challenge, pay close attention to any shifts in your urine color.
If you notice it getting darker, it's an immediate cue to drink more water, and you'll likely start to feel the benefits almost instantly. Your energy will pick up, your skin will look healthier, and your body will start functioning at a higher level. So remember, dark yellow or amber urine isn't something to ignore. It's a sign that your body is asking for more water. And the solution is simple: hydrate. Let's make it a goal to stay ahead of dehydration and keep that urine color light and healthy. Let's take a moment to talk about a urine color that definitely raises a red flag: when your urine turns red or pink. Now, I know this one might cause some concern. Seeing those colors can make anyone think something is seriously wrong. And while it's not always a cause for panic, it's something you should never ignore. Red or pink urine can be a sign of blood in the urine, a condition known as hematuria. But before you jump to conclusions, it's important to understand that there are several reasons why this might happen, and not all of them are linked to a serious health problem. However, the key takeaway here is that when you see red or pink urine, it's a signal that you need to pay attention and possibly seek medical advice. First, let's talk about the common causes that might be behind this. One of the less concerning reasons for red or pink urine is the food you eat. Certain foods like beets, blackberries, and even rhubarb can give your urine a reddish tint. This is perfectly harmless and usually clears up once those foods have passed through your system. So if you've recently enjoyed a beet salad or a handful of berries, it's possible that your urine color is just a temporary result of your diet. It's always a good idea to keep track of what you're eating and drinking, because sometimes it's as simple as that. If the color of your urine returns to normal after a day or two, then you likely don't have anything to worry about. However, if your urine remains red or pink and there's no connection to food, then it's time to look a little deeper. Blood in the urine can be caused by a range of medical conditions, some of which are more serious than others. One possible cause is a urinary tract infection, or UTI. UTIs are quite common, especially in women, and can sometimes lead to blood in the urine. Along with the red or pink color, you might also experience pain or a burning sensation when you urinate, frequent urges to urinate, or cloudy urine. If you notice these symptoms along with the change in color, a UTI could be the culprit. Another possibility is kidney stones. When stones form in the kidneys and move through the urinary tract, they can cause bleeding. The pain associated with kidney stones can be severe, and you might also see blood in your urine. It's worth noting that kidney stones are typically accompanied by other symptoms, like sharp pain in the back or lower abdomen. If you're experiencing this type of discomfort along with the color change in your urine, it's best to consult a healthcare provider as soon as possible. In some cases, blood in the urine could be a sign of something more serious, like bladder or kidney cancer. While this is less common, it's still important to recognize that persistent blood in the urine should never be ignored. If the color of your urine stays red or pink, even after you've ruled out foods and other benign causes, it's critical to get checked out by a doctor to make sure there's nothing serious going on. Early detection is key, and catching potential issues early can lead to better outcomes. The bottom line is this: seeing red or pink urine is not something to brush off. It's a warning sign from your body that something may be wrong, and even if it's caused by something as simple as a food you've eaten, it's always worth keeping an eye on. If the color persists, or if you experience other symptoms like pain, discomfort, or changes in your urination habits, don't hesitate to reach out to a healthcare professional. It's always better to be safe than sorry when it comes to your health. So while a little pink or red can sometimes be linked to something harmless, don't ignore it if it doesn't go away. Take action, and listen to what your body is telling you. If you're in doubt, it's always a good idea to consult with a doctor. Let's keep being proactive about our health and ensure we're on the path to a healthy, happy life. Now let's talk about another urine color that might cause a bit of confusion: orange. Seeing orange urine might make you think something is seriously off, but before you jump to conclusions, let's break down the potential causes and what they really mean for your health. In many cases, orange urine isn't an immediate cause for alarm. In fact, there are a few common reasons for this color change, and most of them are not as concerning as they may seem. But of course, it's always important to understand why it's happening. So let's explore some of the possibilities. One of the most common causes of orange urine is dehydration. Yes, I know, hydration again. When you don't drink enough water, your urine becomes more concentrated with waste products, and that can lead to a darker yellow or even an orange color. This happens because the pigments in your urine become more concentrated when your body is trying to hold on to fluids. So just like with darker yellow or amber urine, if you notice an orange tint, it's a sign that your body needs more water. The good news is that if dehydration is the culprit, drinking more water will help return your urine to its normal color, usually within a few hours. However, there's another potential cause of orange urine that's worth noting: certain medications. Some medications are known to cause urine to turn orange, and this is often completely harmless. For example, the antibiotic rifampin, used to treat tuberculosis, can turn urine a bright orange or red. Similarly, medications like phenazopyridine, which is used to treat urinary tract infections, UTIs, and relieve pain, can cause urine to take on an orange hue. If you're taking any prescription medications, this might be the reason behind the color change. It's always a good idea to check the side effects of any medication you're on, especially if you notice a sudden change in your urine color. Another culprit that can cause orange urine is eating certain foods, particularly those high in beta-carotene, like carrots, sweet potatoes, and pumpkin. While these foods are packed with nutrients and great for your overall health, they can sometimes lead to an orange tint in your urine, especially if you're eating them in large quantities. This is completely harmless, and will usually resolve once you've balanced out your intake of these foods. It's just your body processing the pigment and excreting it through your urine. But in some rare cases, orange urine could be a sign of liver or bile duct issues. When your liver is not functioning properly, or if there's a blockage in the bile ducts, it can lead to the buildup of bilirubin, a substance that gives bile its color. When bilirubin is present in high amounts, it can affect the color of your urine, turning it orange or brown. If you notice that your urine is consistently orange and accompanied by other symptoms like yellowing of the skin or eyes, jaundice, or if you're feeling fatigued, nauseous, or experiencing pain in the upper right side of your abdomen, it's important to get checked out by a healthcare provider. These could be signs of liver problems that need medical attention.
It's also important to note that while orange urine is often a sign of dehydration or medication use, it's still something you should keep an eye on. If you're well hydrated and not taking any medications and your urine stays consistently orange, it's worth discussing with a doctor just to rule out any underlying health conditions. While it's rare for orange urine to be a sign of something serious, it's always better to be cautious and make sure everything is okay. So if you notice your urine turning orange, take a moment to evaluate what's going on in your life. Have you been drinking enough water? Are you taking any medications that might be affecting your urine color? Have you recently eaten a lot of foods rich in beta-carotene? If you're in doubt, don't hesitate to consult a healthcare professional. They can help pinpoint the cause and give you peace of mind. Remember, the goal here is to stay in tune with your body and pay attention to what it's telling you. Orange urine doesn't necessarily mean something is wrong, but it is a sign that you should check in with your hydration and other habits. Let's keep moving forward and ensure we're always listening to the messages our bodies are sending us. Let's now dive into something that can definitely raise some concern when it comes to urine color: cloudy urine. If you've ever noticed that your urine has a cloudy or murky appearance, it's understandable to feel a bit uneasy. Cloudy urine isn't as clear and easy to interpret as some of the other colors we've discussed, and it's often a sign that something isn't quite right with your urinary system. But before we jump into what could be causing it, let's first talk about what cloudy urine might look like and why it happens. Cloudy urine can range from slightly hazy to fully opaque, and it might have a milky appearance. While it's common for urine to have a slight cloudiness now and then, especially if it's been concentrated due to dehydration, persistent cloudy urine is something you shouldn't ignore. So what could be the cause? One of the most common reasons for cloudy urine is a urinary tract infection, or UTI. UTIs occur when bacteria enter the urinary tract, and they can cause a variety of symptoms, including cloudy, foul-smelling urine. When you have an infection in the bladder or the urethra, the presence of bacteria, white blood cells, and other debris in the urine can make it appear cloudy. You might also experience other symptoms, like pain or a burning sensation during urination, frequent urges to urinate, or even pelvic discomfort. If you're noticing cloudy urine along with these other symptoms, it's important to get checked out by a doctor as soon as possible. UTIs are quite treatable, but if left untreated, they can lead to more serious complications, including kidney infections. Another possible cause of cloudy urine is the presence of kidney stones. These small hard deposits that form in the kidneys can sometimes be passed through the urinary tract. As they move, they can irritate the walls of the urinary system, causing bleeding and inflammation. When this happens, the urine may become cloudy, and you might notice some discomfort or even sharp pain in your lower back or abdomen. Kidney stones are often associated with a very intense, sudden pain, sometimes described as one of the worst pains a person can experience. If you're seeing cloudy urine and feeling significant pain, it's a good idea to seek medical help to rule out kidney stones and get the treatment you need. Cloudy urine can also be a result of dehydration, although it's usually accompanied by darker yellow urine in this case. When you don't drink enough water, your urine becomes concentrated and can appear cloudy due to the buildup of waste products and salts. In these instances, drinking more water usually clears things up. However, if you're staying well hydrated and still noticing persistent cloudiness in your urine, it's time to look into other potential causes. Another factor that can contribute to cloudy urine is the presence of phosphates. These are minerals that are commonly found in foods like dairy products, beans, and nuts. Sometimes, when the body excretes excess phosphate, it can form crystals that cloud the urine. While this is usually harmless, If the cloudiness is consistent and doesn't go away, it's worth checking with your doctor to make sure it's not a symptom of an underlying issue. In some cases, cloudy urine can also be caused by more serious conditions like bladder or kidney infections, sexually transmitted infections, STIs, or even certain cancers. While this is rarer, it's important to recognize when the cloudy urine is persistent and not linked to something like dehydration or diet. If the cloudiness is accompanied by other concerning symptoms, such as pain, fever, or blood in the urine, it's crucial to get medical attention as soon as possible. The key here is that cloudy urine is often a sign that something needs attention, whether it's an infection, dehydration, or a more serious health issue. If your urine is cloudy and it doesn't clear up after increasing your water intake, or if it's accompanied by pain or other unusual symptoms, don't wait. Reach out to a healthcare provider. Getting checked early can help you address the issue before it turns into something more complicated. Ultimately, the goal is to maintain clear, healthy urine, which is a good sign that your urinary system is functioning properly. If your urine ever turns cloudy and stays that way, it's a reminder from your body that it's time to investigate further. Listen to what your body is telling you, and don't hesitate to take action when something doesn't seem quite right. Let's continue paying attention to the signals our body is sending, and take the necessary steps to keep everything in balance. Now let's talk about a color of urine that may not be as common, but it's important to recognize when it happens: blue or green urine. This is one that really catches people's attention, and understandably so. It's not something you expect to see. When you notice your urine turning blue or green, it can feel alarming, but in most cases, it's not something to panic about. The causes behind blue or green urine are often harmless, though it's still worth paying attention to, especially if it doesn't go away after a short period. So let's start with a more common, benign cause: certain foods and drinks. While it might sound strange, foods with natural dyes or strong pigments, like asparagus, certain berries, or even foods with blue food coloring, can sometimes give your urine a blue or green tint. This is generally harmless and temporary, and it will resolve once the pigments are processed by your body and flushed out. If you've recently eaten something like blue jello or have indulged in a large portion of asparagus, that might be the culprit behind the change in color. It's a clear reminder of just how interconnected our food is with everything going on inside us. It's also a good example of how something as simple as your diet can influence your body's waste products in ways you may not expect. That said, what happens if you haven't eaten anything out of the ordinary, and your urine still has a blue or green tint? Well, there are some other possible causes, but they're generally tied to medication or supplements you might be taking. For example, a drug called methylene blue, which is sometimes used in medical settings to treat certain conditions, can cause urine to turn a bluish color. Similarly, medications like triamterene, which is used to treat high blood pressure or edema, can cause your urine to appear bluish or greenish. This is typically harmless and just a side effect of the medication, but if you notice a color change after starting a new prescription, it's always a good idea to check with your doctor to confirm that it's a normal reaction and not something more concerning. There's also a possibility that blue or green urine could be a sign of a urinary tract infection, UTI, caused by a specific type of bacteria. One of the bacteria that can lead to UTIs, Pseudomonas aeruginosa, is known to produce a pigment that can turn the urine a greenish color. If you notice that your urine is green and it's accompanied by other symptoms like a burning sensation while urinating, pelvic discomfort, or an increase in the frequency of urination, then it's a sign that you may have an infection. In these cases, seeking medical attention is important, as UTIs can escalate if left untreated, potentially affecting the kidneys and causing more serious complications. In even rarer cases, blue or green urine could be related to a genetic condition called familial benign hypercalcemia. This is a metabolic disorder that can cause excess calcium in the body and may occasionally be linked to unusual urine colors. But again, this is very rare. More commonly, medications or food-related causes will be behind the color change. It's also worth noting that certain artificial dyes in processed foods or drinks might be strong enough to alter the color of your urine. If you've been drinking a lot of brightly colored beverages or eating packaged foods that contain artificial colors, it's possible that these dyes are causing the color change. This is not usually something to be concerned about, but it's always good practice to take note of what you've been consuming recently. So to recap, blue or green urine doesn't usually indicate a serious health issue, especially if it's a one-off or temporary occurrence. Often it's due to something as simple as food, medications, or even artificial coloring. However, if the color persists, or if it's accompanied by other troubling symptoms like pain, discomfort, or fever, it's important to seek medical attention to rule out any infections or more complex conditions.